Why not? He's here, and we love what he's doing. He founded a program directed towards youth, primarily black males, black men. It's the number one cause of death, homicide, ages 15 to 34 for black guys. And he has Kings Against Violence initiative where he really is saving so many lives in Brooklyn, but I'm sure it's beyond. Just want to wrap up the health thing for a second. I remember having like a lot of phlegm and nasal issues. I thought it was sinus infections, and eliminated dairy.
That was the first thing for me when I was
Done.
I was in high school.
What?
And I eliminated. Queen Afua was my neighbor growing up.
Really?
Queen Afua, Supernova Islam. Matter of fact, he and I went to high school together. But they were my neighbors when we were in the 7th grade, and so I had that the book Heal Thyself, and I started reading. Matter of fact, that was my first major influence in going into healthcare. Reading that green and white book that was on my mother's nightstand, and started looking at how do you tweak your environment, and how do you change your health to have an influence and impact on your health and well-being.
Dairy, not for us.
Dairy, sugar, processed stuff. You need sugar in your diet. You need fats in your
Glucose,
diet. Right, you need all that stuff.
And stuff.
But you can get fruits and veggies, nuts, seeds, avocados. Now, does everybody need to be a vegan? You have people who can argue against it. Some folks, you might need to have other products during certain times of the year or as we get older, depending on our age. And so I don't want to get into like that debate.
But people should know their bodies more importantly.
Right. You have to pay attention to what works. If you feel like crap every time you eat something, common sense will tell you don't eat that stuff no more. But things like sugar, are addictive. It acts on the nerves, and it's probably just as addictive. It's a drug, just like cocaine, just like heroin, all that stuff. It's an addictive substance. So you got to figure out, how do you beat the addiction?
Let me give away this book. Dr. Rob Moore is in the house. I got a billion more questions from him. I'm like, why did it take this long for you to come back?
I don't know.
I remember we had a great conversation last time. I'm like, man, he needs to come back, and it was like, where you been? I saw you in the hallway when you were on Sylvia's show. I was like, hey, Doc, weren't you on my show? It was like, yeah, I remember you. It was great.
We got to do. I'm here. I'm just across the water.
There's no excuse, Smiz. We got to have him in more regularly. All right. Let me, Portland, Nakia, you are a winner.
Yes, hi.
Hey.
Oh, thank you, Karen. I just want to say thank you for all you do and for your whole team that you put together and made me smarter and work harder and do better things with my life. And I just bought that book, Brainwash, and I just got buy one, get one free right now.
Yay. Well, you're not getting brainwashed. You're getting For Colored Girls Who Have Considered Politics by Donna Brazile, Yolanda Caraway, Leah Daughtry, and Mignon Moore. But I love that you got brainwashed, too, because we got a lot of work to do. A lot.
Mm-hmm.
Well, thank you, Nakia. Appreciate you. I hope you enjoyed the book.
Thank you.
Right. All right. So, Dr. Gore, we were talking during the break about why it seems as if we can't get there. And, we were talking about putting systems together and having a way to duplicate success. You were telling me about Phil Knight's book, and I was like, can we do that, what he did?
Yeah, I think we can create our own individual Nikes and companies of that magnitude. First thing is we have to be comfortable with failing. I don't want to say failing. I think experimenting and tweaking things so we get it right. We also have to get comfortable with people telling you no. Just because somebody tells you no, they don't like your idea, they don't like your product, doesn't mean you just stop there. You take the criticism and take the feedback and see how you can tweak it. But the other thing is figuring out how do you build your team to help you carry out this mission. None of this stuff is a one-person problem. None of these things are one person, one man, one woman, one individual solutions that can fix these situations. You need to orchestrate an entire movement. And one thing about those movements, you're going to create your initial team to carry out what it is that you're trying to do. But the other thing is you have to plan who your successors are going to be. We don't plan for that. So if you look at institutions in the black community, from businesses, the black church, we don't
to
often,
leadership.
Yeah, leadership
You
in
look at the
general.
Congressional Black Caucus. Maxine Waters is 80.
Right. We need
Marsha
younger...
Fudge, who was gonna be, challenge, what's her name, Nancy Pelosi. She's 70. Where did 20, 30, 40-year-old people who are raised up, among them, where are they?
Well, it doesn't start when you're 20 or 30. It starts when you're in high school. It starts when you're in middle school and getting active in your schools and getting active in your community. Having people say, this is a problem that we can tackle. That's something that maybe a 10 or 12-year-old can try to take care of, and that's when that stuff starts.
But somebody has to, like what you're doing with mentoring
you have to create
these young
space.
people. You're creating the next Rob Gores through working with these kids now. That's my point. It's like people get to positions and they want to close the door behind them, or want to sit on the top of the mountain and direct traffic forever.
No,
as
you
if
can't
you're
do
gonna,
that.
instead of raising up somebody who can supplant you.
Right. Now, I constantly talk to young people, and when I'm it's funny. Young people, those are folks in their 30s, but I'm constantly talking to the people in their 30s, their 20s, their teens, even in middle school. Today, I talked to this young brother who is from New York, and he's applying to medical school. He's interviewing at Downstate today. Deshaun has been doing some incredible work up at City College, and he's going to be a physician soon. And, so we talked about community engagement. How do, some of the failures that we've had, how do you make sure you continue pushing this stuff and passing on that torch? And, that stuff means a lot to me, just the people are reaching out and having these questions, because I had the same things. There's a brother named Answorth Allen. I got to give a shout out to Dr. Allen. Dr. Allen is an orthopedic surgeon over at Hospital for Special Surgeries, and I met him when I was 16 years old because I had some injuries. I didn't know the guy was going to be black, and I had interest in medicine, and he said, you got to check. He said, you want to be a doc? You want to make this stuff happen? We're going to get you there. And for a 16-year-old, from pre-gentrified Brooklyn who heard this stuff, and you got this, like, man, you're a doctor. You've already made it. He's like, no, we're going to make sure you get there. And those words were so powerful. So I already knew I could get there. I might have had to study a little bit differently and change up a couple of strategies along the way. But I was always confident that I could get to that place. And at Morehouse, there was a guy named Dean Blocker who passed away, and Dean Blocker was our pre-med dean. And he said, what you say you are now becoming. So, if you want to be a doc, you say you want to be this leader in the community, you say you want to change healthcare and challenge healthcare delivery and stuff, this stuff starts now. It's not going to start later when you finish college. It's not going to start when you're in medical school. It's not going to start when you're in residency or post-residency. It starts now. And so get in the habit of making sure you play these active roles in learning and understanding community engagement, because this is how we're going to be able to deliver these things to our patients and, more importantly, the people in our communities.
Dr. Rob Gore, the Gore, that's an interesting name for a lot of reasons, because you're an emergency room doctor. Mm-hmm. What's the goriest thing that you've seen?
Oh, man,
in your time?
I think you got to figure out, what year. I've seen hands ripped off.
The first time say what now?
I've seen people, in Chicago, there were things that people used to do. They used to call it elevator surfing. And I remember we had this 12-year-old kid whose arm was pretty much ripped off because his arm got caught in a cable while they were riding on the tops of elevators. And, it was, I had never seen anything like that. He lived, but he was 12 years old and he was high. I've seen someone who was decapitated.
Were you able to say what?
I took care of a kid who wound up, he was decapitated. There was a bad car accident, and it hit him and his parent, and his head came off. It was just attached by skin. And so, there's a lot of trauma and tragedy. You just got to figure out, what day, what year, what month. But there's always something that's tragic.
Was there ever anything that made you say, I don't know if I want to continue to do this work?
Yeah, a few years ago, there was a patient that got, I actually talked about part of it in my TED talk. But there was a guy who got shot in the head. He got shot in the chest and got shot in the face. And I wound up intubating him in the ER, and he wound up dying. And I had to, right after we pronounced him dead, I had to run to the next room because there was another person who was shot, and he was like 20-something years old. He had shot in the back. I'm not sure if it went in the back and out the belly, or in the belly and out of the back. And he had already had wounds on his back before because he had been shot in the past. and we got him up to the OR, and I took care of another case, and I ran out in the hall because there was the family members were for the person who died were out in the hall, and I ran out into the hall, and there was this woman. She's like, "Hey doc, how you doing? Remember me?" And I thought this is random sister who was walking in the halls. I'm like, "Yeah," she's like, "Hey, remember me? You took care of me when I had my miscarriage." I said, "Yeah, I remember you." I was like, "I'm sorry about for your loss." And this was like a couple of months prior, and I'm like, "What's going on? How can I help you?" She said, "I know that my boyfriend came in. We just know there was a bunch of shooting. There was a big shooting, and a bunch of people got hit, and we know he got taken here. Is he okay?" I'm like, "Who's your boyfriend?" And she told me the name, and I remember the woman. I remember talking to the boyfriend, and it was the person that I just pronounced dead. I had a conversation with him a few months before about him and his lady losing their child, and I broke down. And I usually cry in front of patients, but I didn't know how to tell her. And I've had this conversation about loved ones being, lost and dead, but I didn't know how to, I couldn't hold it together. And I broke down in the hallway as she fell and hit the floor because I was this deliverer of bad news. And, another similar incident took place not too long after my mentee Willis was killed in 2015. There was a 15-year-old kid who died in the ER. And I came in, this was like a few days after Willis died. And one of the nurses said, so-and-so is here as a patient. And this is the brother of the patient that I had taken care of a few years before who had died. And now he came in with multiple gunshot wounds. And I went into the room to talk to him, and he was looking at me crazy. And I said, "I cut my hair off." And he recognized me because he knew that I'd taken care of his brother, and he did the mark of the cross. And we had a very different rapport, and he was really calm after that. His mom walks in the room to ask, what's going on. I got to tell her what we need to do in terms of diagnostic studies. And she says, and she looks at me, and she goes, "You cut your hair." Because she remembered me because I told her 15-year-old kid had died a few years before. And then when I was leaving the room, she said, "Do you remember what his last words were when he died?" And I was like, shit. I didn't know how to hold it together. I was already anxious just being in the trauma area because that was the same area that I work in all the time that Willis was taken when he was stabbed multiple times. And then, and his funeral was like 2 days before, and I'm not in a good space.
Right.
And the woman who I told her 15-year-old kid is now sitting there in front of me again while I'm telling her 22-year-old has been shot up. And she couldn't even make eye contact with me anymore because.
So you're like the Grim Reaper.
Yeah, it's like the Grim Reaper, but it's there are a lot of us who wind up having these conversations that are in emergency medicine, who do trauma surgery, and I think for me it just hit home because this is where I live.
Right.
And
how important is it, Dr. Gore, talking with Dr. Rob Gore, that it's your face, right? That you care. You're from this neighborhood. You love this community. That you're delivering this message. How important is that? Because I'm imagining that, coming from you, even if I don't want to hear it, I'm sure you're delivering it maybe differently than somebody else.
Right. It's not, medicine and how I deliver news or how I try to make sure that my docs that work as a part of our team deliver news. We want to make sure that people realize these are families. And, I tell them sometimes, it's like, sometimes these are people that I know. And so how you treat them and how you talk to them, they're going to come to me and tell me what you did wrong, especially when I see them in the neighborhood. But we also want to make sure that we always kind of help them be at their best. We don't need to sugarcoat anything, but we need to be a support system because many people who come to our hospital at Kings County, and I'm also at SUNY Downstate, the patients there are coming from marginalized spaces where they don't always have support, where they don't always understand what's being told to them. And so if you have to say something 2, 3, or 4 times just because they don't get it, and it's going to make a big difference and have a positive impact on their health and well-being, then you got to say it all those different times. And when they know it's a friend of mine or somebody coming from one of the neighborhoods, they make sure that they step up to the plate. But it's not just, I use that as an example. The docs that we work with, particularly on my teams, are often really well-versed in providing those kind of services. That's why many of them came to our hospital to begin with,
right.
Not just to experiment on
But this should
people.
be universal.
It should be universal. And hopefully one day.
Especially if we're disproportionately impacted by this kind of trauma.
Big time.
We should have people who are disproportionately sensitive.
Yep. And so that's actually a good thing. Trauma-informed care is something that we are trying to push. We didn't come up with the name trauma-informed care, but it's just a special delivery in terms of helping how we provide services to people who've been affected and impacted by violence and trauma. It's not just, I just, sprained my ankle and I can just talk to you a particular way and I can discharge you and you go on your crutches and you're going to be fine. We're talking about somebody who's got physical injuries and deep-seated emotional injuries, and the stuff that they've experienced may be an additional trigger to stuff that they've been dealing with their entire lives.
Dr. Gore, let me take some calls.
Okay.
866-801-8255. Let's go to Brooklyn, your backyard. Wayne in Brooklyn, you're on with Dr. Rob Gore.
Hey, Rob.
Peace, Wayne.
What's going on?
What's going on, Wayne? Peace. Thanks for calling.
How you feeling?
Oh, man, I feel pretty good.
How's everything?
Oh, man, I can't complain.
Yeah, man, I just got the email from Laughlin, and I was,
Oh, what up, Wayne?
Now you know which Wayne
Yeah,
it
man,
is?
Wayne Rodriguez. This is my boy from, we ran track together.
How's
Wow.
everything, man?
Oh,
Wow.
man, I'm pretty I'm happy to be in this space and be able to use these different platforms. But, like a big thing, Wayne and I went to high school together. I learned how to teach and organize lesson plans and bring together students. That's something that we learned a lot at Bishop Laughlin. I got in trouble. I had to go to Catholic high school.
I went to Catholic high school as well. I didn't because it was trouble.
No, I wasn't. What did my parents say? I wasn't being a productive member of society, and it was either going there, my zone school, or military school, or Piney Woods. You know about Piney
Yes,
Woods?
I do.
Yeah, that's what
that
it's
would
on.
have been punishment.
Yeah, I didn't want to work on a farm.
Yeah,
But everybody know who went to Piney
that
Woods
says,
is doing well.
It says a lot,
Yeah.
though, about your parents and seeing you. And Wayne, thank you for calling. Appreciate that. That's you never know who's listening.
Nah, Wayne's over in corrections. Here in New York City.
Doing another kind of ministry. He's taking the other step. So how many Gores are there?
I don't have any little ones yet. Hopefully soon.
No, I mean when you were growing up, how many siblings?
I was birth control, so it was me in the house, but I also had a foster brother.
Hilarious.
I had a foster brother that I grew up with, and my parents helped raise my cousin, who's 6 years older. My cousin is the dean of the chapel and vice provost at Fisk University.
Nice.
He also went to Morehouse. And my foster brother is he's transitioning. He's a beautiful spirit, and a lot of the work that we're doing now is because of some stuff that went on when we were growing up. And he's gonna get it together. We just gotta hold that in good faith.
Okay, let's go to Jonathan in Missouri, and thank you again, Wayne. Hey, Jonathan. Jonathan, turn your radio down. All right, Smith.
Hey,
You better go ahead.
Peace, Jonathan.
Hang up. Turn the radio down.
You got to turn your radio down so we
Gosh.
can hear you.
No, Smith, put him on hold. Time out. Put him on hold, please. Thank you. That's right. Crystal in Virginia, get it together. Hey, Crystal, call back. Crystal.
Hello?
Hey,
Hi,
Crystal.
Karen.
Yes.
Yes, hi, Karen. First off, I want to say it's my first time calling. I listen to you all the time, and I appreciate you so much. My question was actually for Dr. Gore. I recently graduated. I'm a nurse practitioner, and I'm just listening to some of the stories you say, and right now I work in mental health, which is, really important, and I just wanted to know, how do you maintain your sanity, because it's really hard, to kind of recover from, experiencing all that trauma and, just dealing with some of the day-to-day stresses you do. So I just wanted to know, how do you maintain your sanity? And also, too, I'm inspired as well. I joined a local sorority, nursing sorority here, and also in my city. Me and a couple of other nurses, we starting to, talk to other women in the community, like a women's group, just promoting health, especially women's health, and things like that. So I just wanted to know, any advice you could give to me. And, as I say, my question about how you maintain your sanity and stay safe.
Okay, Crystal. Thanks for calling, first of all. And I like your question, and I wish more people would bring that up. as far as my personal practice, I'm a strong advocate of therapy. I've gone to see a therapist before. I'm not ashamed, and getting a chance to talk to somebody that can be pretty objective, who's not going to tell you what you need to hear, but can also help you with different tactics and techniques to get through hard times is really important. I meditate daily because I have to. We constantly have a lot of mind chatter, and you're running out of the ER and you're seeing all this chaos and it's organized chaos and confusion, and sometimes it's unorganized completely, and it can take a toll on you. So you've got to figure out what happened and learn how to process that. So the meditation practice becomes important. Another thing is having a physical practice. I do practice martial arts. I cross train. I have to exercise almost daily. If I'm not running or lifting or in the dojo, I'm doing yoga stretches, but I have to do something physically just to kind of help release stress and help me learn how to channel energy effectively and efficiently. And last but not least, we could talk about for days, but you mentioned something really important, and joining, having the group of nurses and other nurse practitioners as a support system becomes really important. One, you're doing the same thing. Number two, it's a different level of support that people don't always have, and it sounds like it's a very constructive circle. You need people that can identify with what you're experiencing. Sometimes our significant others and our families don't always understand what the hell is going on with us and what we've seen at work. And you work in mental health, so my hat's off to you. That's a tremendous responsibility. So you've got to have that circle. We got one thing that many physicians and health practitioners, nurses, ER techs, anybody in healthcare, teachers, educators, we suffer from compassion fatigue. We're used to doing for other people and giving, that we don't pay enough attention to our own self-care and our own restorative practice. So vacation, you don't have to go far, but get out of where you are, go into the elements. You don't have to go to another country. That's a nice luxury to have if you have the resources, but go to a park, go someplace, go to the beach, go to the water. If all you got is the East River, go to the East River. The East River can be pretty peaceful.
Beautiful.
It's really beautiful, and it's calming. If you're in Atlanta and you need to be near water, but you can't afford to get to Miami or to the coast in the Carolinas, go to the Chattahoochee River. It ain't big, but at least it's a body of water that you can kind of reflect on.
I love that. And I knew that all of that, what you just said about you, how you get together. Anyway, Yvette in the Bronx, Dr. Gore. Dr. Gore's in the house. Welcome.
Hi, this is Annette, actually.
Oh, Annette, thank you.
Yeah, I really appreciate all these things, especially that self-care. I know right now I'm in the healthcare profession also. I'm a physician assistant in a trauma ER in the South Bronx. And the stress does get to you, but our people really need to see us so many times when they're in these stressful situations, It makes such a difference. I used to do hand and plastic surgery, and even in that area, we were so important when they were coming in needing breast reconstruction after cancer surgery. It makes such a difference when they can ask you, how's the surgeon? Is this what I should do? And you can actually know the hands of the surgeon you're working with and say, yeah, he's good. This is what you need to do. Just the calming that comes over them when they see someone like themselves. It makes such a difference. I'm trying to get together a diverse group of PAs to maybe make a little video and go around to like middle schools and high schools for career days, just because I see such a decrease in minority PAs right now. That's really troubling to me. Mm-hmm. I just wanted to say thank you for being on the air and letting us know that self-care is important also. I'm a little, stressed right now, but I appreciate you.
Okay, well, thanks, you. Well, if you need to talk about it, just reach us out. I guess after.
Yeah. Are you active on the social media?
Yeah, I am active on social media. Siriema, Siriema 22, or you can just type in Rob Gore on Instagram. I also have Twitter as well.
Okay, let's take one or two more calls. People want to talk to you. I like that. Ramon in Illinois, welcome.
Oh, thanks for taking my call. Hey, Dr. Gore.
Peace, Ramon. How you feeling?
I'm all right. You remember me? I was one of your residents.
Oh, oh man. Because I'm listening. I'm like, wait a second. How you feeling?
I'm all right. I'm doing well. 2 years out working. Same old, same old. I heard you on the radio, and I've been keeping up with your accomplishments. And I just wanted to give you a call and say, yeah, God bless. Keep up the good work.
Man,
Nice.
thank you, man. It's good to hear from you. Tell everybody out in Chicago. I said hello. Which hospital are you at right now?
I'm in like one of the small community hospital out in the burbs.
Oh, okay, man. It's great to hear from you. This brother, amazing doc, and was also a nurse before he went to medical school.
Nice.
And one of the most amazing clinicians I've gotten a chance to work with. So, man, I'm proud of you, brother.
Look at that.
Thanks so much. I really do appreciate the tutelage and what you've done for all of us black men and women physicians, and what you've done for the community. It really is a wonder.
Oh, thank you, man.
Man, just listening to that makes me love you even more, Dr. Gore, because a lot of times, as we said, people get to a position, they close the door behind them, or they get, I got mine, you get yours. But I think we're charged, all of us. If you don't give back, if you don't create other yous, if you don't magnify the gifts that you've been given, you are sinning. I really believe that with every fiber of my being.
Now, there's a friend of mine, Evita, who created Nomadness Travel Tribe. So shout out to Evita, and she said something about creating community whenever she traveled, and the importance of that. And I like to apply that in healthcare, and even for you, like being in the media. There's so many times you go into these rooms and places and spaces, and you are the only one that's in that position of, I don't want to say power, but in position of influence.
Yeah.
And it can get really, really lonely, and it can be depressing because people don't always understand where you're coming from. And so you want to make sure you can kind of create a space so that you're comfortable. And part of that process is bringing other people on board that understand your circumstances, that can also help, carry that torch with you.
Amen. Last call, Maurice. And folks, you can reach him, and please go to CNN and vote for this man to be Hero of the Year, because I think he definitely deserves it. Maurice in North Carolina, you're on with Dr. Rob Gore.
Peace, Maurice.
Hey, how y'all doing?
I'm good. We're good.
Good. Dr. Gore, I just really, and Karen, I just love you. I want you to know that.
Oh, thank you.
You are such an inspiration, and the Urban View is truly a movement that is going around across the country. And I really thank every one of you all.
Wow.
Dr. Gore, I just really want to commemorate you, what you're doing, especially among black youth. Myself, I was born in Kings County Hospital.
Oh, wow.
And a couple of my brothers and sisters were too. And the work that you're doing, sir, for the black youth is really not going unnoticed.
Oh, thank you.
And I really want to commemorate you and what you're doing, and even with the areas of health that we really need to be concerned about as African Americans. I really just commemorate your work and what you do, and keep up the good job. And you definitely got my vote.
Oh, thank you. We appreciate you.
And Karen, you continue to do the work. I Got Brainwashed by Tom Burrell, and the book literally changed my life.
Come on. Mine too. Listen, we gave our homework, Dr. Gore. We don't just talk here. We like.
Matter, I need to read the book now.
We give our homework because listen, we have to get to a place, and I'm no longer never have been, by the way, satisfied with mediocrity or us constantly coming back to the same conversations that we've been having for 40, 50, 100 years. It's time for us to move into our rightful places, success, individually and collectively. But it requires us making some changes in our minds first. You know what I'm saying?
Definitely.
Well, you're not brainwashed, so I don't have to worry about it.
No, but I
we
always
all
like
are
to.
in some way.
I always like to hear about these things from a very different perspective, because it challenges who we are and see how we can grow from it.
Well, I'm gonna have you back because I absolutely love you, and I said this before. It shouldn't take 2 years. No,
I should. We're gonna definitely be back.
All right,
we'll definitely be back.
You too close to not being here more frequently, especially on a wellness.
And we gotta work
Wednesday.
out together too.
Yes, hot yoga.
I've done it before, and I'm not the biggest fan of it. I can do Ashtanga yoga or Vinyasa and
You
get
don't
the
look
same
like you
effect.
you don't have enough body weight to sweat as
No,
much as me.
Not when I'm getting out of there, I'm hurting.
Huh? Yeah, man. I'm just saying.
I look
All
like
right.
something's wrong with me.
Okay.